Hello, episode 18 starts now.
Welcome back to the Rewind Report.
And today we're talking about the evil thing of pigment.
Melasma.
We all hate pigment.
Melasma or very resistant pigment. There's pigment. There's sometimes where it might not be melasma necessarily. Melasma is normally associated with hormones.
Yeah.
Mm-hmm. Hormones and heat.
Yeah,
exacerbated by it, but it's almost like it's its own little thing, and it just breeds. It's
like a monster.
It's super hard to
get rid of him.
You can't. I don't think you can ever get rid of melasma, but to maintain it, like once you have melasma, you have melasma. So you can't, like Courtney said, you can't. You have to stay out of heat. So hot yoga, saunas, hot tubs, all of that is risk of flaring up your melasma. Sunlight, any light, risks. So sunscreen hats, no lasers, both have heat and light. And then hormones, so like hormone therapy replacements, birth control, getting pregnant.
Yeah, I think one of the worst things about melasma is that you can't use the IPL, because usually IPL is kind of our gold standard with getting rid of pigment, but unfortunately with melasma, it makes it worse.
It feeds it, basically. It's happy to see it, and it grows, and it spreads. It's not good.
Yeah.
But what are some modalities that you guys use to tackle melasma?
So I think first step, depending on if you want to do like in-office treatments or a home visit or at-home care. At-home care, I think the standalone golden standard treatment thing that works, really the only thing that works. And I'm someone that has melasma, so I tried all over-the-counter products. Don't waste your money. Hydroquinone. Honestly, hydroquinone. Go to a dermatologist. They'll probably mix you up some sort of compounded cream that has hydroquinone in it, maybe a little bit of vitamin C, tiny, small, light dose of tretinoin, and niacinamide or something.
Our pharmacist can make it
but go to a provider that is going to assess your skin and say this is melasma.
Yeah.
Now, downside with hydroquinone is it is basically bleach for the skin. It also has toxicities to like your liver, and there's some other side effects, so you can only be on it for a short period of time. You're supposed to only be on it for 3 months and then off of it
and then take a break
for the rest of the year.
I
would probably start somebody on hydroquinone, see how far we can get with that result, and then I would do some like chemical peels. VI peel is amazing. Also microneedling with CBD is amazing for pigment. Melasma deep down in its roots is it is inflammation. So microneedling really helps kind of disrupt that little garden growing in there.
Glutathione is also really good for pigmentation. So whether you're microneedling it into the skin, or whether you're taking it orally, or you're taking it IV, that's also something good to add as an adjunct to other treatments.
Yeah.
And our newly added to our menu is TXA, which is tranexamic acid. That is usually a miracle. I don't know. It's a miracle. It could be like
microneedling it topically is incredible to do. That's not like a last resort, but I do oral TXA. I do think is something that you reach for if everything else hasn't maybe got you to ideal goal, or if you're seeing some resistance in chemical peels or with microneedling. Only because TXA has a lot of
not everybody's a candidate for it. It can put you at high risk for blood clots if you have other like prerequisite
if you're
factors.
If you're on birth control, you cannot. If you're taking any kind of estrogen, you cannot take TXA. So if you're on birth control, if you're in menopause and you're taking hormone replacement therapy, you are not a good candidate. If you have a history of stroke, you're not a good candidate.
If you're a smoker.
But on
blood pressure.
On the happy side, if none of those pertain to you, then TXA is amazing because you take a very, very small dose. They use it in the operating room too, to prevent people from really bleeding. And it works amazing, but we give a very small oral dose. It's Dr. Karimi's dosing, and it will actually go in and stop communication between, I can never say this word, skin cells and melanocytes, pigment cells, so they can't communicate together. So if they break apart, then you're going to see it fade. It's also an anti-inflammatory, so inflammation goes hand in hand, like Megan said, with pigment and melasma. We just had a client, she looks way different. She loves it. She's on TXA. We did V-Peel because we always talk about multi-modality treatments. So V-Peel plus TXA. She had acne as well. So now she looks completely non-inflamed. Acne's gone almost, and her pigment is almost gone too. So in the right person, it can be a very good tool to have in your box.
Absolutely.
In our box, and we let you have it.
Yeah.
Yeah.
So typically the standard dosing for TXA, again, it's very similar to hydroquinone. It's not a forever thing, so you do have to cycle on and off of it. It is a 3-month, that's as long as you can be on it. We start you off with 2 pills a day, morning and night, for 30 days. We reassess, is it getting better? If it's getting better and we're seeing some improvement, then you continue on it. We just drop the dose to half, so you only take 1 pill a day, and you continue that for an additional 2 months. So 90 days total, and then you get off of it, and we maintain that with some sort of really good skincare that's addressing pigment. And we have a lot
somebody with scars that it looks really good.
Yeah, I mean, it doesn't just target melasma. It targets
it's for any pigment.
Stubborn pigmentation.
Yeah, and piggybacking off of what Megan just said, I always like to tell my patients, protect your investment by doing good skincare at home. So if you're coming in the office, you're doing treatments that are gonna help with pigmentation, you also wanna be on something at home that's gonna decrease or suppress those melanocytes before and after your treatment, so you're getting a good treatment and you're maintaining your results.
Yeah, some sort of brightening cream, dark spot inhibitor. We have
a good
some
one
favorites.
from Is Clinical. We have a good one from Ourself.
Yeah. And then, of course, staying out of the sun and not doing any of the things we talked about in the beginning of this video that can trigger melasma to come back. So, sorry, girls.
Changing birth control. Going saunas.
No hot yoga.
Yeah, and always wear your SPF. Always.
Every day, even when you're driving.
Yeah, especially when you're driving out here,
I will add, too, one thing that is talked about with at least melasma. So once you've done like your V-Peels, you've either done hydroquinone or maybe you're a candidate for TXA orally, and we've used it to microneedle. You can microneedle TXA too. Even if you are on birth control, there's way less risk topically than there is orally. But after you've done all that, if you still have shadows or kind of that remaining pigmentation that's hanging out there, the one and only laser that they find safe for melasma typically is a PicoSure. So you can go get a very light treatment of PicoSure, and that does kind of icing on the cake finish it off.
Finish it off, yeah. So that's it.
We'll see you guys next week.
We'll see you next time.